Hello, good afternoon, guys, and today we will discuss the anatomy of lower limb. Okay, we will discuss the osteology first of all, then we will discuss the other anatomical features, the topographic anatomy. In this lecture, I have covered the anatomy of the pelvic region, which is hip bone. So let's get started. First of all, the hip bone consists of three parts: the ilium, ischium, and the third one is the pubis. I will discuss them one by one. First of all is the ilium. This the red part is known as the ilium. Ilium, it has borders. It has upper border, which is this one, upper border. It has anterior border. This is the anterior border, and here is the posterior border. The upper border consists of iliac crest. Iliac crest has two lips, the anterior lip and the middle lip, and in the intermediate there is the intermediate region. The anterior border consists of anterior superior iliac spine, this one, and anterior inferior iliac spine. These are two spines or two projections of the ilium. On the posterior aspect, there is the posterior superior iliac spine and posterior inferior iliac spine. Okay, there are four spines in the ilium. The other part of the ilium is the gluteal part or the gluteal surface, which is the outer surface. This is the gluteal surface, and it has three lines, which are anterior gluteal line, the middle gluteal line, and the posterior gluteal line. These are the demarcated lines of the gluteal region. Okay, so ilium consists of the upper border. Upper border has iliac crest. Anterior has two spines, anterior superior and anterior inferior. Posterior surface has two spines, posterior superior and posterior inferior spine, and the gluteal surface. Then talking about the ischium. Ischium is the posterior part, which is the indicated in the green color, and ischium has a body. It has a body. It has ischial tuberosity, and it has ischial ramus. Ramus means like a hook-like structure. For example, this one. This is the ischial ramus. Okay. First of all, the body. This is the body of the ischium, and it consists of the ischial spine. This is the ischial spine. Ischial spine is one of the prominence of the ischium, and it is very important because here it gives attachment to the ligaments and muscles as well. So the body has ischial spine, above which is the greater sciatic notch. This is the greater sciatic notch, and below the ischial spine is the lesser sciatic notch. These are the notches which give a prominent shape to the ischium, so we can identify which one is the anterior part and which is the posterior part, and the notches are present on posteriorly because it is the posterior aspect, and it is the anterior aspect, and anterior there is the pubic bone. Okay, and the ischial tuberosity, this region is ischial tuberosity, and it is divided into the upper quadrangular area. This is the upper quadrangular area which has four quadrants, and the lower triangular area like this one, the ischial tuberosity. The third one is the ischial ramus. This is the ischial ramus, and it is continuous with the pubic ramus. This is the inferior pubic ramus, and this is the superior pubic ramus. We'll discuss in a second. Okay, let's revise ischium. It has a body. It consists of ischial spine. Above the ischial spine is the greater sciatic notch, and below is the lesser sciatic notch. Then ischial tuberosity, and then the ischial ramus. Okay. The third structure, which the bony prominence, is the pubic bone. Pubis consists of the body. It contains superior pubic ramus, and it contains inferior pubic ramus. First of all is the body. Okay, this is the body, and on the medial aspect, because here we are looking laterally, laterally, because here written lateral view, and this is the medial view. Medial view means that towards the midline of the body. Okay, this is the medial view, and on the medial side, there is the it is known as the symphysial surface, and symphysial surface of both pubic bone combine to form the pubic symphysis. Okay, it is the superior pubic ramus, and here is the inferior pubic ramus, and the inferior pubic ramus is continuous with the ischial ramus and form a pubic arch. Okay, so let's revise. Pubis, it consists of the body, and on the medial aspect it has symphysial surface. On the upper part it has superior pubic ramus, and on the below part it has inferior pubic ramus. Okay, the other important structure regarding the pubic bone is the acetabulum. Acetabulum is very important because it serves as the connection between three of the bones, like this. This is the acetabular area. This is the acetabular area, and it has three areas. First is the acetabular fossa. This is the acetabular fossa. This one is the acetabular fossa. The second is the articulate surface. Articulate surface means this one, from where it is articulating with the head and neck of the femur. The third part is the acetabular notch. This a tiny little crest-like structure is the acetabular notch, and it is converted into acetabular foramen by the transverse acetabular ligament. Okay, this is the acetabular foramen. So, and this is the articular fossa, then it has articulate surface, then it has acetabular notch, which is converted into foramen by transverse acetabular ligament. So the other thing which needs to understand in the medial aspect is the ilium has ilium has the middle border, which is known as the arcuate line. What is arcuate line? It is only visible when we look at the ilium in the medial aspect. This is the arcuate line, which I am highlighting in the green color. This is arcuate line, and it has divided it into two parts. This part and this part. The first part is the iliac fossa, which is upper to the arcuate line, and the second part is further divided into three parts. The second part is known as the sacropelvic surface. The sacropelvic surface has three parts, and it is below the arcuate line. The first part is the iliac tuberosity. This is the iliac tuberosity. The second part, this is the articulate surface of the ilium, and the third part is the pelvic surface. Okay, let's revise this one. On the medial aspect, the ilium has arcuate line, which has divided it into two parts. First is the iliac fossa, and the second is the sacropiliac surface. The iliac fossa has its own attachments, and the sacropelvic surface has three divisions. First is the iliac tuberosity. Don't confuse it with the ischial tuberosity. This is iliac tuberosity. The second one is the auricular surface of the ilium, and the third is the pelvic surface. So, how to identify the side of the hip bone? If you are holding the hip bone, how to identify if it is left or if it is right, or if it is we are holding it in the same direction? First of all, the iliac crest should be held upward. Okay, the acetabulum should be lateral, and the pubis bone should be the anterior one. These three are the main rules for holding the ilium, for holding the hip bone, so we can be confident that we are holding it correctly. Okay, coming towards the articulations. Articulations mean that which joints are formed in the hip bone. First one is the pubic symphysis. It is formed between two pubic bones through their symphysial surface, and it is a secondary cartilaginous joint. The second is the sacroiliac joint. This is the ilium. This is the ilium, and this is the sacrum. So between sacrum and ilium should be the sacroiliac joint, and it is the plain synovial joint. Okay. And the third one, the most important, is the hip joint between the acetabulum and the head of the femur. This is the hip joint, and it is ball and socket joint. Let's talk about some attachments of mainly muscles, because I have discussed the ligament in a bit later. First of all, there are attachments. The one rule we should keep in mind that any projection give attachment to muscles or ligaments. For example, anterior superior iliac spine, ischial spine, or and posterior superior or inferior iliac spine. They all give attachment to any of the muscles. First, first is the anterior superior iliac spine. This one. Let's take another color so that it can be highlighted. This is the anterior superior iliac spine. It gives attachment to the sartorius muscle. This muscle is known as the sartorius. Okay, this is the sartorius muscle. Then the second one is the anterior inferior iliac spine. It gives rise to the rectus femoris straight head, the straight head of the rectus femoris. We are not talking about the insertion but only the origin. Then comes the posterior superior and posterior inferior iliac spine, somewhere here, like this one, posterior superior and posterior inferior. They give rise to the gluteus maximus muscle, the big muscle of the pelvic region. The fourth one is the pubic tubercle. Okay, this is the pubic tubercle, and it give rise to the cremaster muscle, which is responsible for lifting them. It is around the urinary bladder. Okay, the fifth one is the ischial spine. It is the superior view, so we can see that here is the ischial spine, and it gives attachment to the coccygeus and levator ani muscles. Levator ani is the group of the muscles which includes puborectalis, pubococcygeal, and iliococcygeus muscles, and in this diagram these three muscles are indicated. So let's revise. First is the anterior superior iliac spine. It gives rise to the sartorius. Second is the anterior inferior iliac spine, give rise to the straight head of the rectus femoris. The posterior superior and inferior iliac spines give rise to the gluteus maximus. Pubic tubercle has attachment to the cremaster muscle, and the ischial spine has attachment to the coccygeus and levator ani, which is the pelvic diaphragm. We can also say that. The other topic of the discussion is the ligaments, and the ligaments are very important in this case, because not only the osteology but the study of the ligaments is also important, because they are holding the bones together. So there are approximately 12 or 11 ligaments we are discussing today. First one, they are very easy, just remember the origin and insertion of them and it would be very easy to remember them. The name suggests their attachment. First is the iliofemoral ligament, which is between the ilium and the femur. But which part of the ilium? Ilium is the anterior inferior iliac spine, anterior inferior iliac spine, and it gives attachment to the femur. So this one is the iliofemoral ligament, anterior inferior iliac spine. The second one is the pubofemoral ligament. This is the superior ramus of the pubic bone, and here is attached the pubofemoral ligament. This one, pubofemoral ligament. The third is the ischiofemoral ligament. The ischial part, the ischial part is posterior or anterior. Just remember it by the, because the Two pubic bones are attached at the pubic symphysis, so it must be the anterior. So ischium must be the posterior part. This is the posterior view of the pelvic bone. So from the surface of the ischium to the pubis, to the femur, sorry, and this is the ischiofemoral ligament. The three ligaments. First is the iliofemoral from the anterior inferior iliac spine to the intertrochanteric line of the femur between the two trochanters of the femur. We will discuss the femur in the next video. Okay, and the second one is the pubofemoral ligament from the superior pubic ramus to the femur, and the third is the ischiofemoral ligament from the ischial part to the neck of the femur. Okay, the other ligaments include the pubic symphysis. Pubic symphysis is between the two pubic bones. This one, which is I'm highlighting in purple color, this is the pubic symphysis. The fifth one is the inguinal ligament. Inguinal ligament is give attachment from the anterior superior iliac spine till the pubic tubercle, as you can see here, from the anterior superior iliac spine up to the pubic tubercle. This is the inguinal ligament, and it is one of the most important ligaments of the pelvic region because it has many structures passing anteriorly and posteriorly to it, and any compression in the inguinal ligament can lead to the compression of nerves. For example, the sensory nerve of the thigh. So it is very important. The sixth one is the anterior longitudinal ligament. This ligament is not solely for the pelvis region, but it originates from the occipital bone. Okay, from the occipital bone. So here, this is the anterior longitudinal ligament. It is anterior to foramen magnum. For example, here is the foramen magnum. So it is anterior to the foramen magnum and in the occipital region. So here it arises and it goes till the coccyx. So this one we are seeing here, this is the anterior longitudinal ligament and it is anterior to the bodies of the vertebra. This all is the anterior longitudinal ligament, and it has many parts, for example sacral part, the coccygeal part. Okay, the seventh one is the iliolumbar ligament. Iliolumbar means that it is between the lumbar vertebra and the ilium. So, from the apex of the transverse processes of the L5, transverse processes are like this, okay, for originating from the vertebra. So, from the apex of the transverse process of L5 and attachment to the iliac crest, this one. So, this is the iliolumbar ligament. The eighth one is the sacroiliac ligament, and these are two, the anterior and posterior. It is between the sacrum and the ilium. So this is the sacrum, this is the ilium. So in between them is the sacroiliac ligament. Okay. Moving towards the sacrospinous ligament, which is ninth one. Sacrospinous ligament originates from the lateral margins of the sacrum. Okay, this is the sacrum originating from the lateral margins and attaches to the ischial spine. This one, this is the sacrospinous ligament. Okay, the 10th one is the sacrotuberous ligament. In this diagram I will not discuss the sacrotuberous ligament. It is more prominent in the posterior view. So this is the sacrotuberous ligament. Okay, all the way, this one. This is the sacrotuberous ligament. What is the origin of it? It is the posterior superior iliac spine, and it also has attachment to the lateral surface of the sacrum and the coccyx, and it attaches to the ischial tuberosity. Here is the ischial tuberosity. So this is the sacrotuberous ligament, and in this diagram it is more clear. From the posterior superior iliac spine all the way to the lateral margins of the sacrum and coccyx and to the ischial tuberosity. Okay, and then talking about the sacrococcygeal ligament. Sacrococcygeal ligaments are this one. These are very tiny ligaments, and these are between the sacrum part and the coccyx part of the pelvic bone. These are lateral and the anterior, and this is not prominent in this diagram, but you guys need to remember it. Okay. The last one finally is the interosseous sacroiliac ligaments. Interosseous sacroiliac ligaments are this one, and if we remove, let's make it clear. Okay, the interosseous sacroiliac ligaments are these one. These are very strong ligaments, and which is between sacrum the sacrum and the ilium, and apart from the sacroiliac ligaments, anterior and posterior, these also provide much force attachment between the two bones. Okay. Okay. uh, in the sacrococcygeal ligament, from where it arises at the margins of the sacral hiatus. What is sacral hiatus? In this diagram, the sacral hiatus is prominent. It is like opening canal in the sacral region. Like here, it is magnified. It is the sacral hiatus. Okay. Okay. Um, the other part is I want to mention is the acetabular labrum. Acetabular labrum is a band of the connective tissue, and it lines the rim of the hip and socket joint. In the purple color, I am highlighting it. It is the acetabular labrum, and it is also a kind of cartilage, the ligamentary structure. Okay. The last topic is the bursa. Bursa are the structures that provide gliding surfaces, and they prevent the friction between the two structures. In the pelvic region, there are three bursa. First is the iliopsoas bursa, which is also known as the iliopectineal bursa. This one. The second one is the ischial bursa, which is also known as the ischio-gluteal bursa, and the third one is the trochanteric bursa. First is the iliopsoas bursa. As the name suggests that there must be some indication of the psoas muscle. So let's discuss about it. It is a synovial bursa that separates the external surface of the hip joint capsule from the tendon of the iliopsoas muscle. Okay, of this one. So this is the iliopectineal bursa, and on the anterior side there is the iliopsoas muscle. Okay, for example this one. So it separates the external surface of the hip joint from the from the tendons of the iliopsoas muscle. So in this regard, it is preventing the friction between the two structures, the muscle and the joint. The second is the ischio-gluteal bursa. It is located over the bony prominence of the ischium. Okay, it is located on the bony prominence of the ischium, and it is between which structures, the gluteus maximus and the ischial tuberosity. Okay, this is the ischial tuberosity, and here is also the gluteus maximus muscle. So there must be something that reduces friction between the ischial tuberosity and the gluteus maximus. The third one is the trochanteric bursa, and its function is similar to the two bursae. It also reduces friction between the trochanters of the femur and some muscles. Okay. The last thing is the hip joint. Hip joint it's ball and socket joint, and it is filled with the synovial fluid. It has cartilage and it has ligaments. We have discussed them, and synovial membrane. It has a hip capsule which provides the gliding surface for the head of the femur. Okay, I hope in this video the main high yield points regarding the hip bone is clear. So that's it for today. And in the next video, I will discuss the anatomy and osteology of the femur. So till next time, goodbye.